The same thing, I believe, happened in Crimea, unfortunately. So the sad truth is there's a number of people in this book who appear in this book who are no longer with us because they lost their lives to overdose, some to suicide following the closure of all of the methadone programs in Crimea after Russia illegally annexed the peninsula. In Russia, they have a very regressive public health policy around substance use. Also, their HIV epidemic is off the charts, and it's a very oppressive place to try to do public health work with vulnerable people. So after Russia annexed the peninsula, we saw them doing all these really interesting things, and I'm sure you've had a lot of really interesting conversations with other sociologists and political scientists about, changing the money and changing the flags, and, even the brands of wine that were in the producti were changing, and all of these performative things to be like, now this is a Russian place, right? Among the many, many things that they did in that sort of shock transition into Russianness, so to speak, was close the methadone clinics, because methadone clinics are very un-Russian places in that sense. They did not have to do that, right? There were 800 people in Crimea at the time of the annexation who were stabilized on medication. So the invasion happened in February, the illegal annexation in March. By May 2014, methadone clinics were shut down with almost no notice. And that came a few weeks after the person who was then the head of the Russian Drug Control Service, Viktor Ivanov, said that people would be allowed to stay on their medication through the rest of the year. And that if you are going to do something as ill-advised as shut down methadone clinics, giving people a long window is the most advisable way to do that unadvisable thing, if that makes sense. Like, people need time to make a plan, to transition, and leaving treatment cold turkey like that is actually really dangerous, because this is a relapsing disease. And when you go back to street drugs, it's very easy to overdose because your tolerance has changed, and street drugs don't come with an ingredients list. So more than 100 people died in the weeks following that shutdown. And what was incredible to me was this was not just cleaning up the administrative, like the paperwork side of government. This was performative. This was part of their political theater of making things, a Russian place, just as much as having Medvedev out there, like, shaking hands with people receiving Russian passports. One of the things that they chose to do was incinerate the remaining stocks of methadone on the peninsula, so drugs that could have literally kept people alive. And they had journalists there. We have photographs of this moment when Russian guy literally carrying rifles and looking like they're ready to storm out of some trenches. Very overdressed Russian police officials just delicately throwing bags and bags of prescription medication into an incinerator.